So this is a great question. Do I have enough fat for a fat transfer? And I would say that on almost anybody, the answer is yes. So typically, if you're a smaller person, you have less fat available to transfer, but you also need less fat in order to augment an area. So if you want your breast augmented or BBL or your hip dips filled in, something like that, you typically do have enough fat. We just have to find it. The most common areas that I take fat from in these situations are the waist flank area and the inner thighs and sometimes the lower abdomen. I routinely do patients cases that weigh less than 130 pounds and want a fat transfer. I have done probably someone as small as 110 pounds. And that patient actually had like a 6 or 8 pack, which was incredible, but she wanted her hip dips filled in. And so we found fat on her waist flanks and her inner thighs, I believe. So I think that the fat does exist. You just have to find it. Because I do this so commonly on really thin, small patients, I have actually been given the name the Fat Whisperer by my friends and colleagues. So I am the Fat Whisperer, apparently. So I do think it's possible. I think having gained 35 pounds is more than enough to have a fat transfer, probably to more than one area. So partly it depends on how much you have available, and partly it depends on how much you're wanting. But I definitely think that almost everybody is a candidate for a fat transfer.